Now I'd like to move to our informational items, item D. And Dr. Davis, number 1 was Back to School 2020. So I'll turn it over to you.
Thank you, Madam Vice Chair, members of the board. I'd like to invite Dr. Greg Benton to the podium. He is going to anchor a rather, I'm going to say, comprehensive presentation that's been prepared for the Board of Education related to our Back to School 2020 responsible reopening plans. What you're going to actually see is that Dr. Greg Benton has been the lead facilitator of our steering committee for reopening our schools, and many executive cabinet members will also participate in this presentation. And so we will just continue to approach the microphone for a very detailed and comprehensive overview for the Board of Education related to reopening preparations. So Dr. Benton, let me turn it over to you to kick us off, and then we'll go from there.
Thank you, Superintendent Davis. Good afternoon, Madam Vice Chair, members of the board, and Madam Superintendent. The Back to School Steering Committee was formed to facilitate the back to school plans for the 2021 school year. It is important to note the work of the 6-member steering committee, working team captains, and team members is founded on the board's core beliefs and commitments. More specifically, our belief that family and community involvement is critical to student success, and all school environments should be supportive, safe, and secure. Our day one work included a meeting with Superintendent Davis and her team, providing us with a clear purpose and sense of direction. The steering committee began defining our workflow processes and expectations for all working team members to ensure work integrity, and most importantly, to ensure that the outputs were aligned to the board's policies and expectations. We continued under the spirit of ensuring that our final recommendations and outputs were founded in principles of factual data from official sources such as the Department of Public Health, the American Academy of Pediatrics, and the Georgia Department of Education's Path to Recovery Plan, which really served as the primary governance source. The presentation will be represented by each of the 6 steering committee members, sharing information about the back-to-school construct and the various methodologies to capture the voices and perspectives of parents, students, communities, and employees as aligned with instructional, operational, and civic processes for our final decision points. We are cognizant of the significance of the body of work and the decisions at present and forthcoming by leadership, parents, and employees who have concerns about the current conditions in our community regarding COVID-19. We further recognize how this body of work impacts the lives of our students, our parents, and employees, and we remain steadfast that the options offered for our families and the information being provided strikes a balance with our core beliefs and commitments of academic excellence while recognizing the needs of our families. Please allow me to share that during the past 3 weeks, the Executive Cabinet, Superintendent Davis, have offered unwavering support of our steering committee work, including allocation of time, resources, and meetings. #We are truly better together. Now I'll defer to Ms. Caitlin Sims, Senior Director of School Support, who will share more details about the operating definitions of our school working teams. Thank you.
The back-to-school planning work was organized into 7 working teams. Each team had cross-divisional captains and a steering committee liaison. Each team was assigned an area of focus, which included 1, staffing, scheduling, and student return, 2, safe, healthy, and inclusive environment, 3, learning, recovery, and adjusted pacing with aligned resources, 4, professional development for employees, 5, policy and legal updates, 6, parent resources, and 7, communications strategy. Over the past month, we were excited to engage over 120 perspectives through these 7 working teams to coordinate, drive research, gather input, and develop considerations for each area of focus, and to deliver comprehensive recommendations for our return to school. Each working team engaged a sub-advisory group to gather school-level perspective and divisional expertise along the way. The sub-advisories included school principals from elementary, middle, and high schools, assistant principals, classroom teachers, support staff, counselors, as well as personnel from specific departments and divisions who could best inform their work. Working teams and sub-advisories met frequently each week, and team captains met as a collaborative group weekly in order to share their progress across each area of focus and to gather additional input and feedback from each other to take back to the working teams. Now I'll pass to Erica Harrison-Arnold, Executive Director of Legal Compliance, to share how we have rooted our work in research.
Henry County Schools is not alone in this very important work of redefining what school will look like during this COVID-19 pandemic, as you all know. We were among the 212 school districts in the state of Georgia who closed nearly 126 days ago, when public health officials were just beginning to figure out and understand the coronavirus pandemic. So to put this moment in perspective, we are one entity in a country of 26 states and jurisdictions, in a world of about 191 countries whose education system was disrupted as a result of coronavirus. But Henry County Schools is unique in that we must make the very best decisions for this community of families and of children. So the steering committee and our working teams took very seriously the charge of basing all of our recommendations in research and authoritative guidance. Each week since early June, we have identified, shared, and read articles, journals, to ensure that we were putting forth the very best recommendations. Resources that served as our foundational documents are on the screen. 1, the Georgia Governor's Executive Orders. Since March 12th of 2020, when the governor held a press conference and recommended that school districts consider closing school operations due to COVID-19, there have been at least 14 executive orders that have somehow affected school districts. We've watched those closely and we've incorporated those into our recommendations. Georgia Department of Education. On June 1st of 2020, the state's education department published Georgia's Path to Recovery for K-12 schools, wherein they outlined different approaches depending on whether a district's community was experiencing substantial spread, minimal to moderate spread, or low to no spread of COVID-19. And based on present information from our public health officials, in this moment, here as I stand, Henry County Schools is categorized as minimal moderate spread, and our recommendations follow that guidance. The U.S. Department of Education has a dedicated COVID-19 informational page. In March 2020, the federal department began releasing guidance on many topics, and I'll just name 2. For example, they released guidance on protecting students' personally identifiable information within their education records under the Family Educational Rights and Privacy Act, or FERPA, while also balancing the community's need to better understand the spread. And they also published, for example, guidance on honoring Individuals with Disabilities Act, or IDEA, in a remote learning environment. Those are some examples of some of the guidance that's been posted. And we're following Henry County Schools' back-to-school planning operations, which was released on June 12th, outlining, as we know, Scenario 1 of in-person with an option for families to enroll remotely, and Scenario 2 of an all-remote option should that need to be deployed. Additional resources leveraged throughout this process by our steering committee and our working teams include information from other public health agencies, organizations, and consulting with our local physicians. And we also reviewed Metro Atlanta school districts and their preliminary recommendations, in addition to other recommendations coming from various school districts throughout the country. While we looked at research within the education sector, we also grounded our work on the qualitative research that came from our parents and our community. Jadon McCarthy, Strategic Executive in the Policy Planning and Systems Development Department, will now overview our approach to community engagement.
Good afternoon. As Dr. Bitton, who opened this presentation, mentioned, One of Henry County Schools' core beliefs is that we believe family and community involvement is critical to student success. Our commitment to that core belief is that we will foster connections for family and community to support student learning. As the Back to School Steering Committee and working groups endeavored to begin planning for this year's unique and challenging return to school, there was an intense focus on and recognition of the need to ensure that multiple voices, perspectives, and ideas were solicited, collected, and reviewed. The Back to School Steering Committee and Dr. Davis also wanted to provide the community members and stakeholders multiple channels of communication so that our parents, students, and community stakeholders would remain informed of our plans and steps to return to school. As such, multiple channels of community engagement were developed and executed to continue fostering connections for families and community to support learning. Let's briefly discuss some of the community engagement activities that have happened to help us to prepare to return to school. During the spring and summer, 6 surveys were deployed to different groups to gain the perspective of the community and some of our employees with regards to our remote learning activities and plans for returning to school in the fall. The Return to School survey was deployed to parents asking about their prospective plans for returning to school. This survey had over 14,000 responses, which helped to guide some of the planning work. In addition to the Return to School survey, surveys focusing on the community's reaction to remote learning were deployed to students, parents, teachers, and school administrators, and those surveys garnered almost 7,000 responses. In addition to the surveys that were given in late June, 3 separate town hall meetings were conducted and streamed on the district website and via YouTube. These town hall meetings, which focused on district and building leaders, employees, and community members, allowed the district to engage in dialogues with those groups about planning to return to school. Another avenue for community engagement involved soliciting the viewpoints of the superintendent's advisory councils, which included students, teachers, and community stakeholders, including members of the local chambers of commerce. These advisory councils allowed for in-depth discussions about issues and concerns confronting the district as it prepared to return to school. The steering committee also wanted to create a direct line of communication with parents, students, and community members, and so a dedicated email channel was created. This email channel allowed for questions, concerns, and comments related to back-to-school preparations to be sent directly to the steering committee members. This email channel saw over 450 emails, and those 450 emails included over 800 questions and comments. Many of the questions and concerns from the email channel were reviewed and compiled into a frequently asked questions FAQ resource, which is featured on the district website for parents, students, and community members. We have been very fortunate that the parents and community members of Henry County have engaged with us as we have begun planning for returning to school. Across the thousands of survey responses, the multiple town hall and advisory council meetings, and the email channel viewpoints, Henry County has gathered a large volume of community perspectives and insights. Now, Allison Norsworth, the district's facilitator of research and grants, will discuss how the community's input, as well as the committee's research and the tremendous efforts of the back-to-school working groups, led to our back-to-school recommendations.
Good afternoon. As you can see, our cross-divisional working teams researched, benchmarked, and worked countless hours to create a responsible plan to return our students and staff back to school. As Ms. Sims mentioned earlier, each team had tight weekly project plans that took into consideration the frequent shifts required as new information was received. Comprehensive templates were used to guide the work of each team, and there were weekly opportunities to share progress with team captains and the steering committee. Working teams and captains collaborated not only with each other, but also with school-based and district employees to make these recommendations. Each of the 7 working teams, in conjunction with their sub-advisory teams, composed of principals, teachers, and staff, submitted their top recommendations to the steering committee. All aligned to instructional, operational, and civic considerations. As a steering committee, we synthesized the recommendations from each working team into an executive summary that was shared with executive cabinet for their review. The approved recommendations will be represented in the playbook, website, and other communications. Ms. Shanika Clay, Director of Financial Efficiency and Effectiveness, will now share with you the phases of the playbook and next steps.
Throughout this presentation, we've shared our methodology to bring together authoritative guidance, stakeholder insights, and community voice to design the Henry County Schools back-to-school plan. The hours of research, discussions, and deep critical thinking were distilled into the key points necessary for parents and guardians to make informed decisions about how their children will return to school in August. Launched on July 8th, the first iteration of the playbook focuses on the physical and virtual learning environments that parents can expect from Henry County Schools. Using the playbook and information available on the Henry County Schools website, parents and guardians have started to register their preference for their children's learning environment, and they are able to do so through July 17th. The public synthesis of recommendations from the Back to School Task Force, an organization comprised of more than 120 direct team members, marked a critical transition from planning to implementing. This body of work will now be led by our division chiefs and their staff. There are more than 77 recommendations that are now being transitioned to each division leader for further consideration. The intentional selection of working team captains who lead different departments within this organization supports a natural continuation of the collaborative and research-based work that started with the back-to-school planning. Each division will focus on developing guidance and protocols to support school administrators, teachers, and staff in launching the 2020-2021 school year. I will close with a huge thank you to every team member of the Back to School Task Force. Your efforts demonstrate why Henry County Schools is one of the best places to learn, even as we meet the challenges of our current environment. Dr. Davis, that concludes what we've prepared, and I turn it back over to you.
Thank you. And if I could just take this moment and publicly acknowledge Greg Benton, Caitlin Sims, Erica Harrison-Arnold, Allison Norsworthy, Jadon McCarthy, and Shanika Clay. Sleepless nights is an understatement from what you undertook. And as you were each introduced, your actual title, reflecting that you actually have other job responsibilities, was also reflected. And so I do want to publicly thank you, the captains that you worked directly with, the 7 working teams that you developed, the sub-advisories that you developed, and the comprehensive examination of how to be responsible in this season as a public school entity for this community. It is really remarkable, and I'm incredibly proud of the intellectual skill, the perseverance, and really the responsiveness that this team demonstrated and modeled for our entire community. A commendable job, well done. But Madam Vice Chair, members of the board, what you just heard was the process to arrive at where we are today. We're now going to take some time and talk about these actual responsible reopening strategies so that the board has sufficient information to think about whether we are adequately prepared or what maybe our fall semester start needs to look like. As a matter of fact, we know we are not here with a complete picture, but we do know that we have a strong start to help families understand their best choices, as well as our employees to have direct consultation regarding their unique circumstances. So as I begin the second half of this presentation, I'm also going to be bringing other participants to present deep information in our back-to-school planning process. But let me begin by starting that what you see on the screen is what we released in actually beginning in May and then officially in June regarding how our back-to-school season may look. We introduced two specific scenarios. The first scenario was an on-campus opening with a remote learning opt-in. We're going to spend a lot of time talking about that today. But the second scenario that we have been acknowledging since May, continued to acknowledge as part of our planning process in June, was scenario number 2, the possibility of a delayed on-campus start with remote learning actually beginning on August 3rd and the on-campus environment to be determined. But I do need us to acknowledge that at this point in the summer, every industry, every organization, every higher education institution, every K-12 provider, every industry is working to establish strategies to responsibly reopen access to its stakeholders. Of course, in our case, stakeholders are students and their families, and as a K-12 provider of education, we actually consider access to a public education vitally important to the health of a community. From airlines to manufacturing plants to doctors and dentist offices to retailers and grocery store providers to farmers and construction companies, absolutely every industry is taking strides to incorporate safety measures to change the physical environment so that there can be a responsible reopening in each industry. Henry County Schools is no different. Henry County Schools is taking seriously the responsibility to modify our physical environment, modify our behaviors and routines, modify our emergency preparations, essentially reinvent school altogether to take the same strides that every industry has been responsible for taking during this unprecedented time. And there are still weeks to go before the start of our school year, and so the report today represents where we are today. It also represents a realization and a full comprehensiveness that it is our responsibility to assess and reassess, not just daily, but hour to hour within each day, and to maintain continued daily contact with public health officials. There are districts around our community that are beginning to announce 1 week, 2 week, even 3 week delays. And as it stands today, we believe our responsibility is to give the Board of Education a comprehensive look at the types of modifications physical campuses can potentially represent so that we too can make the right decisions for our community in the days and weeks ahead. I also think what our steering committee represented and a handout that they also provided you that demonstrated the extensiveness of the working teams was a small reflection of our attempt to engage in our community. You know, the heart and soul of communities still resides in schools. And we will never forget this important position we play in the health, the stability, and the livelihood and the life of a community. So I do want to make sure that the Board of Education continues to remain familiar with not only our attempt to do weekly leader town halls with our leaders in our organization. We've done an employee town hall, a parent town hall. I've met with the mayors and city managers on 2 occasions, with a third occasion still scheduled. I've done virtual town halls with the Chamber, the Economic Development Authority, and the county manager. I've worked with District 4 public health officials on a daily basis. I met with the pediatricians in our community through a virtual town hall and actually included our District 4 public health professionals on that call. Unsolicited, I do need to mention that our Department 4 public health officials have deemed Henry County Schools to have the most responsible reopening plan and seems to and believes that our efforts for preventative measures are the strongest and most practical that they have seen. And I also have continued to monitor the back-to-school email address that has been accessible to our community and reviewing the correspondence that continues to come. We know that this is a community conversation. This is not an isolated decision-making opportunity. So today we talk about where we are today, and we will continue to assess, continue to engage, continue to be present in this community, and continue to think about the right, responsible reopening for our community. So you know our two options under scenario 1, and I'm going to elaborate on those two options under scenario 1 with a little bit more detail, and then we'll talk a little bit more about scenario 2. So let me advance the slide, and let me go ahead and talk about option 1. The return to on-campus allows families a choice to choose on-campus learning. And what you can actually see are the on-campus modifications that we are prepared to layer in to our school campus community. You will see face masks for employees will also include etiquette and expectations. That will mean that our face shield and the face mask that we will provide every employee, and those will be required during transitions if they are on a bus or serving on a bus, or when any responsible distancing cannot be maintained. Our face masks for students will also be accompanied by etiquette and expectations, and that means students will be encouraged to bring their own face masks so that they can responsibly clean that on a daily basis, and we ask that it is aligned with our appropriate attire in our code of conduct. It was also, there will be face masks on campus if that is needed. We will also require face masks during transitions on the bus and when responsible distancing cannot be maintained. We are inviting our families to join us in our daily health checks and expect that employees and students along with their families will monitor their temperature and their health each morning before they leave for work and for school. Other on-campus modifications that we are prepared to make, if we advance back one slide, that we will have the opportunity to increase our air filtration maintenance and the amount of time that we replace air filtration in our ventilation systems. We will have self-serve sanitizers throughout the building, where at each intersection in each of our campuses there will be self-serve sanitizing stations. We will transition our visitor policy for the time being, where we will have no lunch visits during this time period, nor will we allow for there to be any volunteers or class field trips at this time. We will have responsible distancing markings throughout the school facility so that we can maintain that responsible social distancing in our campus, and we will use consistent signage for each of our 50 campuses and our district facilities. Our water fountains will be for water bottle filling only, and we will have established restroom protocols and transition protocols. Now, part of making a decision about returning to on-campus for our families is to think about whether the preventative measures in place are appropriate for their child's education. It's also important for our employees to understand that the preventative measures that we are layering in, I think it's important to note that school won't look like it did in August of last year. As a matter of fact, it won't look as it did in March of last year. We have changed the status quo. As a matter of fact, the status quo is now students learning remotely. And this is now thinking about the steps necessary to move towards the campus being accessible to the public in a responsible way. I'd actually like to invite Mr. Malcolm, our Chief Operations Officer, to join me in this presentation and dive deeper into our facility modifications prepared to support preventative and safe, responsible reopening. Mr. Malcolm.
Good afternoon, Madam Vice Chairman, members of the board, Dr. Davis. As she mentioned and as Shanika mentioned, for the back-to-school playbook, just want to go, I'm not going to go through all of it, but wanted to go through some of the highlights that we've developed to date for some of the measures that you're going to see. So I'm going to highlight some of the adaptations to facilities and buses that are currently being implemented. These include, and Dr. Davis has mentioned some of these as well, hand sanitizing stations are being installed at high-traffic areas. Signage for items such as responsible distance reminders, encouragement of face coverings, and hand washing will be installed. Cleaning and enhanced sanitization, you see that throughout the back-to-school playbook. As we have developed our plan with our custodial contractor, they've been able to offer many suggestions due to the fact that they work with many other organizations. I won't go into every aspect of the plan, but here are some highlights of what we will be implementing. And this plan that's 6 pages long will also at some point be attached to the back-to-school playbook so that anyone can see them as well. But actions that they're taking for their employees, additional hand sanitation stands have been deployed at the employee time clocks. Time clocks are sanitized throughout the day. This is when we start back to school. Staggered start times will be implemented for crews, and the use of face coverings and gloves will be required for all SSC employees. Moving over to inventory. SSC has been able to successfully procure all needed custodial supplies for the new year, to include the enhanced sanitization that I'm going to talk about in a minute. Equipment. SSC has procured electrostatic sprayers, backpack sprayers, Clorox 360 machines utilized in the disinfection process. These particular units will be utilized in the fall cleaning plan to address the disinfecting of classroom space and public gatherings. Current approved custodial cleaning plan. Won't go through all that again, just give you some highlights of that. It will be posted again. All general cleaners have been replaced with EPA-rated virucides. All touch point areas will be disinfected multiple times per day. These areas include, but are not limited to, the following: tables, doorknobs, light switches, countertops, handles, desks, elevator buttons, railings, vending machines, drinking fountains, although with the drinking fountains we are going to restrict that to refilling of water bottles only at this time, push plates, and bathrooms. SSC will be focusing on highly used areas, providing additional disinfecting and cleaning. They will also provide porter services for specific areas like computer labs when requested by the school. SSC will be focusing on deep cleaning the building while the majority of the students are not on campus. They will be doing sanitization during the day, but they will focus their deep cleaning at night like they usually do. They'll do that cleaning when they don't distract instruction. SSC recommended that staff and faculty clean and disinfect their personal items in their office, things such as phone, keyboard, mouse, TV, and computer. I'll get into that in just a minute there about what we're going to provide to the teachers as far as doing those kinds of things. And then general cleaning procedures during COVID-19. These are added safety procedures. Change out gloves after each of the following tasks: bathroom cleaning, floor mopping, office cleaning. Utilize spray bottles or bucket of disinfectant taken from J-Fills. Utilize a 2-rag system while cleaning offices. A rag that is used in the office is then disinfected while another is used in the next office. Wipes and rags are both used to clean touch points in the office. Rags are changed out throughout the day. Restroom rags are changed out after use. And office, hallway, common areas are changed out periodically throughout the day. And then finally, disinfecting utilized in buckets is changed out is based on soil loading after each restroom cleaned is performed. So you can see there's been a lot of thought through this. We've gone back and forth with them. They've given us our plan. The back-to-school committees have come back and given us their suggestions. We've gone back to them. We've added in some things. So it's really been kind of a collaborative between both of us. And then finally, as far as disinfection that you're going to see this year in the schools that we haven't seen in the past, they're going to do it for different areas. Especially at the bathrooms, they're going to do that 4 times a day now. One of the times will be at night, but the other times they'll be doing that during the day, when a lot of times some of that is moved to the night. And the touch point areas that we mentioned earlier, light switches, door handles, things like that, they're going to do that 4 times a day as well. So you're going to see custodial staffs where we've had back-ended it, where we've had the people mainly at night and then some porters. We're going to move some of those back into the regular day so that they can handle this increased disinfection throughout the day in the schools. So a lot of planning has gone into the SSC plan. We will continue to refine that plan, and then that will be posted in our playbook as well. Moving down to a couple of other things. We mentioned this just a minute ago. Water fountains will be used only for refilling of water bottles right now. Additional air filtration, Dr. Davis mentioned this, will be accomplished through a preventive maintenance program to include increased changing of filters and cleaning of coils. A plexiglass shield will be provided at the front office counter for all schools. So it won't be the entire length of the counter, but it will be an area where if you have a visitor, you can go behind that and you can do business with that person and still have something between you. Distancing reminders will be provided in areas such as hallways. That's putting tape out there just to give them an idea of what a proper distance is for distancing in those areas like that. Sanitizing wipes will be provided to teachers for personal high-touch areas such as computer keyboards and mouses. Playground equipment will not be in use to start the school year. Face coverings will be required on buses. We mentioned that previously. Loading and unloading procedures will be modified for buses, and high-touch areas on the buses will be disinfected after the elementary school, high school, and middle school routes. So they'll hit the railings, the top of the seats, things like that as well. So these highlights today represent greater detail to the items that are mentioned in the Return to School playbook. As we finalize these adaptations, detail will be added to this playbook. So you'll see it continue to adjust, and I'll work with Greg on getting some of these. A lot of it's mentioned, but there are also some details that we continue to put into the playbook. So, Dr. Davis, that completes.
Thank you, Mr. Malcolm. And as you can see, the physical adaptations are an important part of what every industry is considering for their spaces. But we also know that that's a very incomplete picture. And as we advance to the next slide, I want to mention that the playbook was our first release of a physical space modification plan. We know that there is eagerness to understand our COVID-19 response, should there be and when there is a COVID-19 positive result in any of our school campuses. And so I'd like to invite Jessica Stormer to the podium to begin to give insight to our Board of Education on our COVID-19 positive response protocol. This is our first time discussing this with the Board of Education, and it will be a part of our next playbook that gets released more publicly. Ms. Stormer.
Members of the board, Vice Chair Cobb, and Madam Superintendent. As everybody probably knows, we are in the midst of one of the most challenging times that school systems have faced. To do that, we know that a critical component of effective preparation is to ensure that we have a consistent student protocol in place for confirmed or potential COVID-19 diagnosis. This ensures that we are prepared to respond effectively, consistently, and in accordance with public health guidance in each circumstance. We must be consistent as we roll these guidelines out, and they must be step in line with our Department of Public Health. So we know in order to do this, there are 3 distinct areas defined by the Department of Public Health and the CDC for specific action. Number 1, that is when we are notified that there is a positive COVID-19 test or diagnosis. Number 2, that there are individuals who have been exposed to a positive COVID-19 diagnosis. And number 3, suspected or possible COVID-19 diagnosis due to or based upon identified symptoms. These are also the 3 areas that are recommended for specific action to prevent community spread, and also the 3 areas that are referenced in the governor's executive order from March 14th, 2020. We know that to ensure the safest environment possible, we must make consistent decisions that are in line with the latest guidance from our public health officials. And in doing that, we are monitoring this guidance on a daily basis. Our lead nurse, Amy Rivers, is monitoring this guidance from the CDC, from the Department of Public Health, and others as we move forward to make sure, because as you know, the guidance does change from time to time as more information is discovered. So, in accordance with these guidance, we have outlined a specific protocol for each of these identified scenarios, confirmed, exposed, or possible, to include recommended actions in alignment with the Department of Public Health return to school guidance. In all cases, students who present with illness or who are identified for further assessment will be assisted in a pre-identified school location that is separate and away from others, that is also staffed by a trained Henry County Schools individual. We are prepared to respond when we're notified of a positive COVID-19 test or diagnosis. When there is a positive COVID-19 diagnosis or test, because they can be 2 different things, the confirmed matrix will be used to determine the course of action for when students may return to school, for public health notification, for communication, and for cleaning. And so the Department of Public Health recommends a time-based return to school strategy, not a test-based return to school strategy, and that is included in our protocol. Additionally, specific action will be taken for those who have been determined to have had close contact or exposure to COVID-19. And when we talk about exposure to COVID-19 or close contact with COVID-19, there are definitions provided by the Department of Public Health along with the CDC. Those definitions are being within 6 feet of a sick individual for 15 minutes or more. Number 2, living in the household with somebody that has a positive COVID-19 diagnosis. Number 3, caring for somebody that has a positive COVID-19 diagnosis. Or number 4, being exposed to the bodily fluids, direct contact with bodily fluids of somebody with a positive COVID-19 diagnosis. So our decision-making matrix for exposure will guide our decisions in alignment, of course, with public health guidance for returning to school, for public health notification, for communication, and also for cleaning and sanitation. So we also know that without a diagnosis, students are going to be identified who may need further assessment based on symptoms that are observed by our teachers, by our bus drivers, by, pick a person. And so when we find that students need additional assessment, we will follow our possible matrix for student evaluation. And this will be done by trained professionals with close supervision by our Henry County Schools nursing team and in consultation with our public health officials. We remain in constant communication with our local public health officials, and we rely on them and work hand in hand with them to make decisions for students and for our schools regarding returning to school, public health involvement, communication, and cleaning. So now, I believe, turning it over.
Thank you, Ms. Stormer. And as we think about the responsibility to document that for review and further public consumption, that will be our next phase of a playbook that will be released this week. And so this conversation is just the beginning of that, of course. As we advance to the next slide, the option number 2 in our first scenario is for families to choose remote learning. And there's been, of course, a lot of questions about the role of remote learning and what will it look like for my family if we choose that. And so as we talk about that remote learning, I think it's important to discuss that there's going to be a level of similarity to the remote learning experience that students and families had in April and May. However, there will be a more standardized schedule of instruction, and there will be aligned grading, participation attendance, and engagement expectations comparable to that of on-campus learning. The teacher, in most cases, will be a school-based teacher of the school the child typically attends. And I do think it's important that as we start the fall, we're acknowledging that the content standards, the pace of instruction, the assessments used in classrooms, as well as the instructional materials that are accessible in classrooms that are also digitally available will be comparable to that as on-campus learning, making certain that the educational experience in the remote environment is going to be strong, reliable, stable, and result in high levels of learning for students. We are in the process of developing a K-2 device availability plan for families in that grade category that may need support for a device at home. And we are also working on our third grade device distribution plan, since third graders are the first in our district to receive a Chromebook. As we further consider the option 2 of registering for remote learning or opting into remote learning, we've developed a bit of a sample schedule that is reflective of standard 3 hours per day of virtual instruction or guided practice, approximately 45 minutes of specials or connections for elementary and middle school, and Friday being served for independent work, extra help hours, enrichment, and intervention. In our high schools, the only change you really see there is the 4 hours per day of instruction, the 1 hour of electives, and the 1 to 3 hours daily of possible independent work, with Friday as that extra help hours, enrichment, and interventions. Of course, this is the schedule for the remote learning option. We are currently in development of a K-5 evening schedule so that families who would prefer to opt into an evening opportunity for their elementary learners will have that option. That is currently in development. At this time, I'd love to ask Melissa Morse, our Chief Learning and Performance Officer, to elaborate more on the details of the remote learning experience.
Thank you, Madam Vice Chair, members of the board, and Madam Superintendent. I do want to provide you a little additional information today so that you can better understand what our opt-in for remote learning will be like for students, and really to provide families with the additional information they need in order to make their choices about opting in to school support, the school in-school instruction or remote learning. And this information will be posted to our Back to School website at the conclusion of this meeting for parents to be able to see. So building on what Dr. Davis shared on this slide, for elementary school, you can see that 3 hours and 45 minutes of virtual live instruction, 3 in the core classes each day with 45 minutes in one of our beyond the core. And of course, in elementary school, that's what we typically call our specials. Students will have this instruction, as mentioned, for 4 days of the week and have that intervention time on Fridays and or enrichment for students who need that additional support and really personalized. This is that opportunity for us to see what students need independently, individually, and provide that for them on those Fridays. So giving students personalized learning in that space. 2 days a week, the students will have instruction in math and science, and 2 days in ELA and social studies, and then the different kinds of specials will rotate throughout the week. So students who opt in for remote learning will have access to services like gifted, interventions, language support, and special education, and Dr. Madden will talk a little bit more about that shortly. So really, based on the number of students we have who opt into remote learning, a student's in-person online, or that live learning, could take place either in an AM session or a PM session during normal school day, the hours of the normal school day. Additionally, as stated up here on the slide, we are also developing an evening session for elementary families that would be from 4 o'clock to 8 o'clock. Again, once we have clarity on the number of students who are interested, families who are opting in, we'll have a better idea of how we should schedule students and then also determine that need for an evening session. But we do recognize that families have a unique need with younger learners who may have difficulty without parental support navigating remote learning during the day, and so that's why we wanted to look at the development of that evening option as well. For our middle school students, as Dr. Davis shared, and as you can see, the schedule is very similar with those 3 hours for core content, 45 minutes to an hour for what they call connections, but also that beyond the core time. Again, with AM, PM sessions within that normal time of the school day. One note that is different with middle school remote option is that choices for connections classes or beyond the core will be limited to what is going to be most commonly available across our schools, and that information is going to be provided in what's posted for families to our website. And then in high school, what we are going to see is that students are going to take a normal course load in the same way they would if they're opting into in-person learning at the school. We don't want to mess with kids' abilities to earn their credits for working towards graduation. We will have live instruction across all 5 of the days of the week. On Friday, we will look, as it states, to see how we can use that for that personalized learning time. Each day, students are going to have 4 hours of live instruction, and again, 2 to 4 hours, 2 to 3 hours, depending of tutorial and independent practice based on the needs of the student. Again, the specifics of which classes will happen on which days and the details of the schedule will all be determined once we know which students are opting into remote learning. Like the connections in middle school, one of the things that I think is important for our families to know is that high school opt-in remote learning is going to be limited to coursework that's required for graduation and in the most commonly taken elective courses in the beyond the core course portfolio. That list of courses is going to be provided. And it's on the website today, and it's going to be based on the availability of classes at each school as well, specific to the needs of the families in that school. If something is a desire for a student to take remotely that is not going to be available, we're asking for families to connect with their school counselors so that they can look at our Georgia Virtual program, as well as the opportunities for dual enrollment, so that they can take advantage of those opportunities as well during the remote learning time and throughout the school year. We're also currently developing a plan right now for what we'll do for our students who are attending the Academy of Advanced Studies. So we know, once we know later on this week which of our families are choosing to opt into remote learning, we can begin to work with school leaders to design the schedules and support them in the effort of designing these schedules for our students. So, Madam Superintendent, I'll turn it to you.
Thank you, Ms. Morris. At this time, I'd love to have you followed by Dr. April Madden so that we can really just continue this conversation about both on-campus and remote learning services for our exceptional student education program.
Good afternoon, Madam Vice Chair, members of the board, and Dr. Davis. Of course, our teams have been working very closely on the back-to-school planning teams. They've been a part of it on a daily basis. So a lot of the plans do reflect our students' needs. However, we know that there's an extra layer that's needed when you are dealing with students with disabilities and staff. So we wanted to talk a little bit about the remote learning plan option first for those parents that opt into that. Students will receive synchronous instruction and or asynchronous instruction designed to address the IEP goals and objectives for our students, with explicit expectations for consistency purposes. Our IEP teams will also have a remote learning plan for our students that will outline the supports and services that the students will receive through this option. The remote plan will also outline the rate of services and how students' progress will be monitored. This plan is not meant to replace the IEP. The district's full offer of FAPE is outlined in the student's individual education plan. Students that will receive speech, occupational therapy, PT, physical therapy, deaf, hard of hearing, and visual impairment will receive these services as indicated in the IEP. Teletherapy and consultative behavior supports will also be provided virtually for our students that whose parents elect the remote option. Now let's talk a little bit about our on-face learning plan. Of course, we want to make sure that we have an additional layer of safety for our staff that are working with our students with disabilities. They'll have gowns and protective wear for our ESC staff. Also, we'll have visual colored MySpace zones within the ESC program classrooms to help reinforce responsible distancing. Our students will be provided the services listed in their IEP, and our instructional delivery will be designed to ensure that they have the least restrictive environment. Our IEP support services will be continued to be provided and aligned to our district's safety and health guidelines. Those services include, but are limited to, our paraprofessionals, our nursing, our social emotional learning, and our related services. Virtual IEP meetings will also be held when needed for those parents that need to engage, as well as our eligibility meetings. All speech and language pathologists will be provided with clear masks so that they will be able to see and show while modeling correct speech production and pragmatic language skills. Of course, training and extended support will be provided to our staff and caregivers that will be supporting our students. Thank you. That concludes my portion.
Thank you, Dr. Madden. And as you can see, the complexity of preparing for students to return to campus is an important responsibility that every school system is addressing. But we also know that it's important to have a very well-communicated plan for our employees. Henry County is the largest employer. Henry County Schools is the largest employer in Henry County, and our return to work for our employees is an important part of this body of work. And I'd like to ask Valerie Sue Smith, our Chief HR Officer, to approach the podium and talk about our return to work approach and our consultation with employees.
Thank you. Good afternoon, everybody. It's good to see you. So as we open school, and as you've already heard, we're putting lots of measures into place to guard our students and our employees' health, safety, and wellness. And while we know that we can't guarantee a COVID-free environment, we certainly can guarantee precautions and protocols are in place and followed that best protect all of us, all created from guidance and consultation with the CDC and our District 4 public health authorities. As Mr. Malcolm mentioned earlier, the district's return to school playbook outlines many important facility adaptation strategies that will be implemented. But then the next question is, what are our expectations for staff? So number one, face coverings. All staff will be provided with a plastic face shield. The expectation is they will be required to wear either the face shield or they'll be required to wear a cloth face covering
when responsible distancing protocols cannot be maintained. Approval to not wear a face mask or a face covering will be by exception only. There are also proper face covering etiquette that we are going to make sure our staff are aware of, that they're communicated and expected. We expect our staff to wear their shields or their face mask during transition times, walking from the office to office, using the restroom, walking down the hallway, going into another teacher's classroom. We also want them to wear their face mask when they are approaching or in someone's office or classroom. We want to make sure that they know how to wear it appropriately, ensuring that it covers your nose and your mouth and you don't expose your chin. So if we just educate people on how to properly wear a face mask, hopefully that will help. You don't wear it under your chin, you don't wear it on top of your head, and you preferably don't crumble it up and stick it in your pocket like I did. Okay, so number 2, then what we're trying to do is talk about responsible distancing protocols. We talk about distancing protocols, but do we really know what that means? Yes, it does mean 6 feet between individuals when possible, but it also means limiting face-to-face contact unless you're wearing a face covering. It means limiting non-essential movement around a building or a facility. It means don't gather in groups. It means don't shake hands, don't trade fist bumps, or perform other high contact kind of gestures. And then we also have to think about our own responsible hygiene protocols. We need to self-monitor for symptoms. We need to stay at home if we are experiencing symptoms. We also have to acknowledge if we've been in contact with somebody who's experiencing symptoms or has tested positive. We need to know how to immediately report to a supervisor if we have concerns about contact, and we need to conduct frequent and thorough hand washing with soap and running water. It's amazing you have to remind adults to do that, but we are going to have to do that. If not immediately available, if soap and water aren't immediately available, then they use a hand sanitizer. Remember to cough or sneeze into the crook of your elbow. Keep your hands away from your eyes and your mouth. Don't use another person's phone. Don't use their desk. Don't use their office. Don't use other work tools and equipment when possible. And then employees will be provided with sanitizing wipes. They will always have access to sanitizing wipes to frequently wash the touch points of copiers, phones, doorknobs, handrails, and etc. with these sanitizing wipes. And just as with students, we have protocols in place as to how we will respond should an employee test positive with COVID, or has had contact with someone who has tested positive with COVID, or exhibit symptoms of COVID. All of these are based on the Department of Public Health protocols and expectations. Our supervisors will know step by step how to respond. No guessing, no Googling, no hesitation. That's really, really important. And if an employee has requested accommodations, such as working remotely, and a lot have, we will be working side by side with principals and supervisors to analyze requests and match them up with student needs. As we said back in June during the employee town hall meeting, we will accommodate to employee personal circumstances to the extent feasible while acknowledging the many medical and emotional needs of our employees. So that's the employee plan.
Thank you, Ms. Sue Smith. And as you can see, this is a very comprehensive body of preparation, but there is a second scenario that our presentation has not touched on. I'd like to just take a moment and make sure that I do acknowledge that the second scenario that Henry County Schools released back in early May and then formalized in June was that the possibility that we may not be able to return to on-campus learning on our August 3rd date, and therefore we would launch our remote learning at that time. You can see that if we were called upon to do that, if the information leads us to that resolution, that we would really use that first week for a lot of orientation and device distribution and scheduling confirmation, and aim to start that instructional experience remotely on August 10th. Now, of course, there are a lot of districts in our neighboring communities that are beginning to make that decision, but I do believe it is prudent for us to evaluate the breadth of information regarding the preventative measures that have been prepared to be put in place, and to evaluate the timeliness in which we are equipped to do that before we jump into that conclusion for our community. As we conclude our presentation today, I do want to acknowledge that this is our season to lead with both empathy and equity in mind, that there is no pretending there is a simple solution, there is no suggesting that there is something that will be a magic formula to make this a perfect entrance into a new school year. But I do believe we have a public responsibility to be clear about how we can prepare our campuses to mitigate and limit risk and to improve and increase safe learning environments, while realizing there are many converging responsibilities to make a responsible decision. This is a season, however, to think about how can we do it. Yes, this is complex and challenging, but what is it we can do? And I believe that just like the previous successes we have had as an organization, it is because our Board of Education and the team of professionals you see in the room have done so together. And now is a time for us to proceed working together. Vice Chair Cobb, that concludes what we have prepared.